We see a lot of estrogen dominance these days, not just in perimenopause. A lot of women are estrogen dominant. I can honestly say I was estrogen dominant from about the age of 14 and throughout my whole life. And we're going to talk about why we're seeing this, but it's a really, really big issue. So high estrogen in women, often there's weight gain. Some of my younger clients, I'm not seeing that, but there's something else going on there. But I said again, it's really difficult because we use these really absolute diagnostic words, estrogen dominance. Actually, very often it's progesterone deficiency. And even when we talked about progesterone dominance earlier, I'm like, but some of those sound like estrogen deficiency. So the medical model are they're very reluctant to talk about a deficiency of something. It's just the dominance just sounds, I don't know why we focus on that one. So menstrual problems such as light or heavy bleeding, because all of this I'm going, that's progesterone deficiency, but we're talking about estrogen. And again, for me, it's this massive estrogen short-sightedness, like this obsession with estrogen in the medical model. So even poor progesterone, when it comes to progesterone deficiency, doesn't get named. It just the focus is on estrogen. So the weight gain, the menstrual problems such as light or heavy bleeding, PMS, hot flashes, fibrocystic breasts, uterine fibroids, fatigue, loss of sex drive, depression, anxiety, also PMDD, PCOS, the kind of the migraines, all of it. High estrogen in men, enlarged breasts, sexual dysfunction, and infertility. So estrogen dominance, or hashtag also known as progesterone deficiency, but it's caused by a couple of things. So we can have true estrogen dominance, and that is often because of endocrine disrupting xenoestrogens that are chemicals that mimic the behavior of estrogens, and they're found in all the things in that list. So junk food will stimulate xenoestrogens. It's in our tap water, xenoestrogens, because of the amount of people on the contraceptive pill. Personal care products have ingredients in them that are called xenoestrogens. Gut dysbiosis, because part of our gut microbiome is called the estrobolome. We're going to talk about that. And it actually absorbs our estrogen. But if we don't absorb it, it just kind of keeps sitting there, getting reabsorbed. And so this sort of like toxic estrogen is kind of just not being processed out. It's in BPA and other plastics. Heavy metals cause xenoestrogens. Body fat, so white fat, not brown fat, white fat will keep producing more and more and more estrogen, which is why you see in type 2 diabetes, it's not just about the insulin resistance, it then becomes about the estrogen dominance, especially in men, where you're seeing men with the secondary sex characteristics of women starting to happen. Obviously, huge amounts of estrogen because of things like hormone replacement therapy and birth control and chronic stress. All of this will cause estrogen dominance, which ultimately means we're going to be in low progesterone symptoms. And so, yeah, they are everywhere, the issues with endotoxins.